بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم. Today we are going to discuss the tooth morphology of mandibular, permanent mandibular premolars. The distinguishing features of the mandibular first premolar from the mandibular second premolar is this mandibular first premolar is smaller in general size than this mandibular second premolar. Mandibular second premolar is larger in general size than mandibular first premolar. The mandibular premolar is buccolingual. This is buccal surface, this is lingual surface, buccolingual, and mesiodistal dimensions are approximately equal. So the buccolingual dimension and the mesiodistal dimensions are approximately equal. The mandibular premolars may have more than two cusps. This is the buccal cusp. These are the two lingual cusps. So the mesiolingual cusp and distolingual cusp. This mandibular second premolar has more than two cusps. So the mandibular premolars may have more than two cusps. You can see that the lingual cusps are less prominent in the mandibular premolars. These are the lingual cusps. This is the lingual cusp, mandibular first premolar. These are the two lingual cusps, mandibular second premolar, mesiolingual cusp and distolingual cusp. These are less prominent as compared to these maxillary premolars, lingual cusps, which are more prominent. These are the lingual cusp of the maxillary premolars, maxillary first premolar, maxillary second premolar, which are more prominent than the lingual cusps of the mandibular premolars, which are less prominent. These two mandibular premolars do not resemble as much as their maxillary counterparts. They are transitional teeth, with the mandibular first premolar resembling the permanent canine. So it is reflecting the transformation from the canine. And the mandibular second premolar is showing the change transition toward the molars. You can see the marginal ridge is also at 45-degree mandibular first premolar, like the canine, whereas marginal ridge is horizontal in mandibular second premolar, like the molar. So it is showing the transition from the anterior teeth towards the premolars, towards the molars. The mandibular first molar has a diminished lingual cusp. This lingual cusp is very diminished and usually non-functional. The second mandibular premolar has two lingual cusps, the mesiolingual cusp and distolingual cusps. So coming to the tooth morphology of permanent mandibular first premolar, the permanent mandibular first premolar is the fourth tooth from the midline in the mandibular arch. It has a mesial contact with it has a mesial contact with the mandibular canine, and the distal contact is with the mandibular second premolar. It is a succedaneous tooth, and it replaces the deciduous mandibular first molar. The buccal cusp of mandibular first molar is functional, whereas the lingual cusp is usually non-functional. From the occlusal aspect, the outline is diamond-shaped. It resembles the diamond. From the facial or buccal or lingual aspects, these are pentagonal or five-sided. 1, 2, 3, 4, and 5. Five-sided. 1, 2, 3, 4, 5. Five-sided or pentagonal in shape. The proximal surfaces are rhomboidal in shape, like a rhombus. It resembles like rhombus. So the mandibular first premolar is resembling both in form and function to a mandibular canine. Coming to the buccal aspect, the shape of the buccal aspect, as I have already told you, is five-sided or pentagonal. The buccal surface is convex both occluso-gingivally, this is occlusal surface, this is cervical surface, occluso-cervically or occluso-gingivally, and mesiodistally. It is convex both occluso-gingivally and mesiodistally. The occluso-cervical dimension is shorter than that of the canine anterior teeth, but is longer than that of the teeth posterior to them. So in case of the mandibular second premolar, the occluso-cervical dimension is shorter. This is the mesial margin, this is the distal margin. The mesial margin is usually concave from the cervical line to the contact area. Here there is concavity, but the concavity is slight. The height of contour at the contact area is in the middle third. This is the distal margin. The distal margin is similar to the mesial margin but a little shorter. The cervical line is convex towards the apex, but the depth of curvature is less than the teeth anterior to them. The buccal cusp tip divides the crown into two portions, the mesio-occlusal portion and the disto-occlusal portion or slope, or the mesial and distal cusp ridges. The mesio-occlusal slope or the mesial cusp ridge is shorter, whereas the disto-occlusal slope or distal cusp ridge is longer. Thus, the cusp tip is offsetting mesially. So, the cusp tip is offsetting mesially. This cusp tip is offsetting mesially. This mesio-occlusal slope is shorter and disto-occlusal slope is longer. This is pushing this cusp tip mesially. This buccal ridge representing the middle buccal lobe is more prominent in case of mandibular first premolar. On either of its sides there are mesio-buccal developmental depression and disto-buccal developmental depressions. The imbrication lines here are faint. The buccal height of contour is found in the cervical third. Lingual surface is also pentagonal in shape. It lacks the prominent occlusal cervical ridge which is present on the buccal surface. This is lacking the prominent occlusal cervical ridge. It is convex in all directions, both mesiodistally and occlusal cervical. It is convex. Most of the buccal half of the occlusal table is visible from this aspect, as this lingual cusp is very diminished in size. The lingual surface is much smaller mesiodistally, or much narrower mesiodistally, because of the convergence of the mesial and distal surfaces towards the lingual. These mesial and distal surfaces are converging towards the lingual, so this mesiodistally, this lingual surface is narrower. So from this aspect, these mesial surfaces and distal surfaces are also visible. The mesial and distal margins of the lingual surfaces are resembling those of the buccal surface, but much shorter, because the lingual surface is also shorter. The cervical line is slightly convex towards the apex. The lingual cusp tip is very short. You can see here, this buccal cusp tip is visible from this aspect because this lingual cusp tip is very short. But it may be sharp, but this lingual cusp tip may be sharp. The disto-occlusal slope is slightly longer than that of the mesio-occlusal slope. Thus, the cusp tip is offset towards the mesial, like that of this disto-occlusal slope is usually longer. Thus, the cusp tip is offset towards the mesial, like the buccal surface. In this case, it is also offsetting mesially. You can see this mesio-occlusal slope is shorter, so both the lingual cusp and the buccal cusp are offsetting mesially. So the portion of crown which is distal to the transverse ridge, this portion is larger than this mesial portion because this area is usually shorter and this area is usually larger. So this distal portion is larger, the distal to the transverse ridge, this distal portion is larger. So this distal portion of the crown is larger because both the cusp tips are offset mesially, because the disto-occlusal slope is longer and the mesio-occlusal slope is shorter in both the buccal and the lingual surface. The lingual height of contour is located in the middle third. Here there is maximum bulbosity or maximum convexity. The mesial surface is rhomboidal in shape. The buccal surface is generally convex with the height of contour in the cervical third. The buccal margin or buccal outline is usually convex and height of contour is in the cervical third. This buccal outline is inclining itself towards the lingual. So it is like, it resembles an old man who is holding a stick and is inclining lingually. So I resemble it like an old man holding a stick and is inclining lingually. This lingual margin is less convex and much shorter than the buccal outline or buccal margin, which is longer. This lingual outline you can see is shorter than this buccal outline. The crest of curvature is in the middle third. The cervical line curvature is towards the occlusal. You can see it is towards the occlusal. You can see the occlusal outline is revealing the buccal portion of the transverse ridge, making an angle of 45 degrees. And it is parallel by this outline of the mesial marginal ridge, which is also more or less inclining at 45 degrees. Since this buccal outline is inclining towards the lingual, this buccal cusp tip is in line with the center of the tooth. This buccal cusp tips is in line with the center of the root. So if you draw a line here, it will become in the center of the root. There is a mesio lingual developmental groove here. This is the mesiolingual developmental, which starts in the mesial pit and ends the mesial marginal ridge and comes onto the mm, mesial surface. The contact area is located towards the buccal and is in the middle third. The contact area is towards the buccal and is in the middle third. It is ovoid in shape, resembling like an egg. The height of contour is of the buccal surface is in the middle third. The distal surface is also rhomboidal in shape, resembling the mesial surface, but there are some differences. There is no distolingual developmental groove, but there is a distal marginal groove. So here there is a distal marginal groove, but no the distal marginal groove, but no distolingual developmental groove. This distal marginal groove may indent the distal marginal ridge. The distal surface is also shorter, occlusal cervically than the mesial surface, which is a bit longer than this distal surface. The cervical line curvature towards the occlusal is usually less when you compare it with the cervical line curvature of the mesial surface. The contact area is also similar to that of the distal surface. It is in the middle third, but it occupies a slightly broader area because it is making contact with the larger tooth like the mandibular first molar, so it will be a bit broad. The distal marginal ridge is not making as a sharp steep towards the lingual. Here there is a sharp steep towards the lingual, but here the steep of the distal marginal ridge is not so sharp towards the lingual. From the occlusal aspect, I have already told you that the shape of this occlusal aspect is diamond shaped. There is a notch at the mesial outline at the mesolingual developmental groove. So here there will be notch in the occlusal table at the mesial marginal ridge. Due to the mesial offset of both this buccal cusp and lingual cusp, the crown portion distal to the transverse ridge is larger. So this crown portion is larger and this mesial portion is smaller. Because of the lingual inclination of the crown, this crown is inclined lingually, so much of the buccal portion will be visible and less of the lingual portion will be visible from the occlusal aspect. The buccal margin of occlusal table is uniformly convex with well-defined though rounded mesiobuccal line angles and distobuccal line angles. The outline of this buccal ridge is most prominent feature of this buccal margin or buccal outline. The lingual outline or lingual margin is also convex but is shorter than that of this buccal margin. Mesial it and near the mesiolingual developmental groove. The mesial outline, this is the mesial outline. The mesial outline is slightly convex to nearly straight. The only exception is the concave offset near the mesiolingual line angle, where the mesiolingual developmental groove transverses it. The distal outline is regularly convex than the mesial outline. Boundaries. Coming to the boundaries, the occlusal table is bounded by the mesial marginal ridge and distal marginal ridge on its mesial and distal surfaces, and on the mesio occlusal slope and disto-occlusal slope or mesial cusp ridge or distal cusp ridge of the buccal cusp on its buccal surface, and the medial cusp ridge and distal cusp ridge of the lingual surface on its lingual surface. The components of the occlusal table are this buccal cusp and this lingual cusp. This buccal cusp is larger and usually the functional cusp, whereas this lingual cusp is diminished or smaller and is non-functional cusp. The buccal cusp tip is offset towards the mesial. This buccal cusp tip is offset towards the mesial. The buccal cusp has got 4 cusp ridges. This is the buccal cusp ridge. This is the lingual cusp ridge or triangular ridge. The triangular ridge is the ridge that starts from the cusp tip and towards the center of the occlusal surface. The third cusp ridge is the medial cusp ridge, and the fourth one is the distal cusp ridge. So buccal cusp ridge, lingual cusp ridge, mesial cusp ridge, and distal cusp ridge. The sloping areas between the two cusp ridges are the inclined planes. This is the mesiobuccal inclined plane. This is the distobuccal inclined plane, sloping area between the distal cusp ridge and the buccal cusp ridge. This is the mesiolingual inclined plane, the sloping area between the mesial cusp ridge and the lingual triangular ridge. This is the distolingual inclined plane, the sloping area between the distal cusp ridge and the lingual cusp ridge. All the 4 inclined planes, this mesiobuccal inclined plane, distobuccal inclined plane, mesiolingual inclined plane, distolingual inclined plane of this buccal cusp are functional inclined planes. This lingual cusp is very small or diminished. It is also offset towards the mesial like the buccal cusp. It also has got 4 cusp ridges: the mesial cusp ridge, the distal cusp ridge, the buccal cusp ridge, and the lingual cusp ridge. Note that this lingual cusp ridge of the buccal cusp and this buccal cusp ridge of the lingual cusp, these two meet in the midline to form a transverse ridge. Since this cusp is non-functional, so none of its inclined planes are functional. So non-functional inclined planes. This is the mesiobuccal inclined plane. This is the distobuccal inclined plane. This is the mesiolingual inclined plane, and this one is the distolingual inclined plane. None of its inclined planes are functional. The mesial marginal ridge is usually sloping at 45 degrees towards the lingual, whereas those of the other posterior teeth like the premolars, the marginal ridges are usually horizontal. So in case of mesial and distal marginal ridge, they are sloping or inclining at 45-degree angle. Coming to the depression, the depressions are usually fossae. There are usually 2 fossae, the mesial triangular fossa and the distal triangular fossa. The mesial triangular fossa is usually smaller, the distal triangular fossa is usually larger. The mesial triangular fossa is usually bounded by the mesial marginal ridge, on the distal by the transverse ridge, on the buccal by the mesial cusp ridge of the buccal cusp, and on the lingual by the mesial cusp ridge of the lingual cusp. The distal fossa or distal triangular fossa is bounded on the distal by the distal marginal, on the mesial by the transverse ridge, on the buccal by the distal cusp ridge of the buccal cusp, and on the lingual by the distal cusp ridge of the lingual cusp. The mesial triangular fossa is usually linear in shape, whereas the distal triangular fossa is usually larger and more or less circular. The 2 pits are usually found in the deepest portion of the 2 fossa, in the mesial fossa. The pit is the mesial pit, and in the distal fossa, the pit is the distal pit. The mesial pit is usually a junction of 3 grooves: the central groove, the mesiobuccal triangular groove, and the mesiolingual developmental groove. The distal pit is positioned in the deepest portion of the distal fossa, and is the junction of 4 primary grooves: the central groove, this distal marginal groove, the distobuccal triangular groove and distolingual triangular groove. There is single root in the mandibular first molar. So this was all about the tooth morphology of mandibular first molar. Hope you understand it. If you have any question or query, you can inbox me. Wassalam.